So Ryan and I are sharing our perspectives as a researcher and also a real-world implementer of HIV self-testing programs. And before we continue, we would like to acknowledge this land on which Ryan and I are presenting from. For thousands of years, this land we refer to as Toronto has been the traditional land of many nations, including the Mississaugas of the Credit, the Anishinaabe, Chippewa, Haudenosaunee, and Wendat peoples. So today, as settlers, we're grateful to not only have the opportunity to live and work, but also be able to build our homes and communities on this land. And so as we start, first, we have a list of abbreviated terms that are used throughout the slides. At the slides, one thing I want to note here is that the term GBM and 2S-GBQM are different terms that are used non-interchangeably. So we use both terms today because since some of our background sources and participants use the term GBM specifically to refer to as gay, bisexual, and other men who have sex with men. But in our research, we use the term 2SGBQM to encapsulate the sort of the diversity we have within our participants, genders, and sexuality. So now I'll get into some of the background on HIV self-testing in Canada. So first, the Public Health Agency of Canada estimates that in 2020, around 63,000 people were living with HIV in Canada, and that 10% of this population was unaware of their seropositivity. And this burden of HIV disproportionately affects marginalized groups such as GBM, African, Caribbean, and Black communities, people who inject drugs, and Indigenous communities, including First Nations, Métis, and Inuit peoples. And often these groups are referred to as key population groups. So an example of this disproportionate burden is the fact that 15 of the 1,500 new HIV infections reported in Canada in 2020, nearly half of the diagnoses were among GBM and 1/5 among Indigenous peoples, despite the two groups representing only around 4% and 5% of the adult population at the same time. This may be due to the fact that in addition to the common barriers to HIV testing in Canada, so think limited clinic hours, difficulty finding appointments, and HIV-related stigma, key population groups face additional obstacles to testing. So this could include stigma and judgment from healthcare providers based on ethnicity, sexual orientation, sexual practices, or substance use, as well as institutions or providers not being informed about community-specific health concerns and needs that could vary between groups based on their cultures, histories, gender, and sexuality. And it would be necessary to have the knowledge to ensure that HIV testing and other sexual health services are comfortable and accessible for everyone. So in this case, the implementation of novel HIV testing modalities like HIV self-testing could help address such barriers to testing and greatly improve sexual health outcomes within not only the general population, but in particular within key population groups. So more about HIV self-testing itself. There are two types of HIV self-testing interventions. One uses oral saliva samples and another uses finger prick blood samples. So in both cases, individuals self-collect the sample, administer a rapid test, and interpret the results on their own. And it's very much similar to a COVID antigen test in that sense. And here I also want to note that self-testing is different from self-sampling interventions in that collected samples don't have to be mailed or dropped off anywhere to be tested by another person or at another location. HIV self-testing can easily be done anywhere and in a shorter amount of time. So both saliva and blood-based HIV self-testing have been found to be acceptable as in individuals are interested and willing to use it, as well as feasible as in individuals can successfully self-administer these tests and interpret the results. And this was among service users in several regions and jurisdictions, including Canada. So some of the examples of these places include Kenya, Malawi, South Africa, in Sub-Saharan Africa, China and Hong Kong in East Asia, United States and Canada in North America, and Australia in Oceania. And studies have also demonstrated that both saliva and blood-based HIV self-testing are effective in removing these general and key population-specific barriers to testing and can increase opportunities for HIV testing, diagnoses, and care. And that's why the World Health Organization recommends HIV self-testing as a convenient, confidential, accurate, and effective method of HIV testing that can reach key population groups as well as those who typically don't get tested for HIV using traditional clinic-based services. And so in Canada, the first HIV self-testing device called INSTI was approved for a medical device license by Health Canada back in November 2020. INSTI is a blood finger prick self-test, so we don't have oral saliva tests approved here in Canada yet, and it's manufactured by Bioanalytical Laboratories based in BC. INSTI has a high sensitivity, so high probability of detecting a positive test result, and also high specificity, so probability of detecting a negative test result. And with all of this in mind, recognizing this potential for HIV self-testing to reduce barriers and increase opportunities for testing, the government of Canada has committed $8 million for the distribution of HIV self-testing kits across Canada. And so a little bit of an overview on HIV self-testing and where it could be accessed before we pass it off to Ryan. So right now, anyone living in Canada can access HIV self-testing through a number of different ways. So first, we have private sales. So HIV self-testing kits can be purchased at select pharmacies that choose to carry them or directly from the Bioanalytical Laboratories website, and they can be delivered to the address that the person provides on the website when you purchase it. According to the website, each kit is priced around $35 or $55 for a bundle of 2 tests. Next, we have research trials. So we have Get a Kit and I'm Ready. Get a Kit was first launched back in July 2020 and I'm Ready back in June 2021. And both studies administer free online-based services that provide HIV self-testing kits. I'm Ready distributes across Canada and Get a Kit currently distributes across Ontario, but I believe they have plans to expand the service nationwide very soon. And HIV self-testing kits in these programs are distributed through the mail or community-based pickup sites. So AIDS service organizations like ACT, sexual health clinics, and pharmacies as well. And after receiving these HIV self-testing kits, users can report their test results online on a voluntary basis. And users also have access to support regarding how to use self-tests, resources about retesting windows, HIV and PrEP and such, pre and post-test counseling and peer navigators, as well as sexual health services and care with local sexual health service providers. And finally, we also have community-based programs. So this includes Test at Home, Test Now, Medicine Bundle, and Our Health Box. And these programs often target specific communities or use distinct distribution methods. So for instance, Test at Home and Test Now from the Community-Based Research Center in BC. They're programs that distribute free HIV self-testing kits nationally to members of the two-spirit, lesbian, gay, bisexual, transgender, and queer community. In the case of Test at Home, the kits are distributed through the mail, hence why it's called Test at Home. And while Test Now distributes the kits through partnerships with community-based organizations and businesses. So this also includes bars, bathhouses, and bookstores. Medicine Bundle is another program from CBRC that provides HIV self-testing kits, as well as indigenous medicine, including sage, sweetgrass, tobacco, cedar, lavender, and other indigenous medicines, sexual health supplies, and other resources for free through the mail to members of two-spirit, queer, and trans indigenous communities within the province of British Columbia. And lastly, we have Our Health Box. It's an initiative that has installed vending machines in 4 municipalities across the province of New Brunswick. And they distribute free to low barrier HIV and COVID self-testing kits, harm reduction supplies, so naloxone kits or clean needles, and sexual health supplies like condoms or lube, as well as health information and directory of local support services that people can access. And so I think I've talked a lot about some of the background regarding HIV self-testing. So and an overview of how people can access them. And I want to hand it over to Ryan to talk about his insights and experience with working with some of these programs and actually providing these HIV self-testing kits to community members.
Thanks, Heeho. So yeah, my name's Ryan Lisk. I am the Director of Community Health Programs at ACT. For those of you who aren't familiar with ACT, formerly the AIDS Committee of Toronto, we are an AIDS serving organization based out of Toronto. We do prevention work and support work to people living with and at risk for HIV of all genders. And all sexual orientations. So our priority populations are gay, bi, queer, MSM, but also women living with and affected by HIV, and also focusing on young people under the age of 29. So our programs are across with 35 staff. We focus on various programs around prevention and capacity building and providing support, but we're not a medical service. So unlike him in Vancouver, we're not an organization that has testing on site and those kinds of services. So when HIV self-testing was approved, this was an exciting opportunity for ACT as a community-based organization to collaborate and try and increase access and uptake for HIV self-testing. So I presume many of you are familiar with, oh, this is not going to show up unless it's in front of my face, but the Insti test. So we're connected to a few different projects at ACT. The I'm Ready to Test, also Reach Nexus, is a national project that most of you are probably familiar with. This is Sean Rourke's work and supported by PHAC. And so we were distributing through them, as Heeho mentioned, that is an app-based registration. People can have things mailed, kits mailed to their house, or they can pick them up at a community-based organization like ACT. We also distribute when we do bathhouse outreach with that project. And when we do tabling or community event outreach, we also take tests into those spaces. And then Get a Kit I'll talk a little bit about because it's a bit more regional and some of our friends in BC may be less familiar with it. The Get a Kit project is the same technology. It's still the Insti test, but it's packaged slightly different. It comes in a box format, and that has been led by Patrick O'Byrne out of the University of Ottawa. It started in Ottawa, developed its technology and its implementation very locally in the Ottawa region, and then adopted additional sites across the province of Ontario. Similar experience for people. It is web-based, not app-based. So people register online, go through a screener. Again, they can have things mailed to their home. They can, or they can pick it up in community at ACT. The experience of coming to ACT to pick up a kit is for folks who may not be comfortable to test at home. They may not have a safe space. They may, as we know, HIV stigma is real. And so for some people, they want to be able to test on site. So despite not being a clinical service, we do have designated spaces where people can administer their own HIV self-test on site in a private room. And so people can use that space, and regardless of the outcome of that test, we have people available to support people. One of ACT's programs is around mental health and counseling. And so for folks who are coming in, they can test no matter what the test result is. We can link to PEP or PrEP, or if someone has a reactive test, we can make referrals to confirmatory testing and linkage to primary care physicians. Okay, Heeho, if you can change to the next slide. I've rambled probably enough on that one. So the data I'm going to present in the next few slides is a snapshot of 2 years, specifically with our Get a Kit data. So the intention here is is presenting this lovely data of these consultations and discussions with community members and with service providers, I wanted to give a snapshot of what does it look like as far as uptake and who is accessing tests out of an organization like ACT, the AIDS Committee of Toronto. So in the last 2 years, we have distributed 1,996 self-testing kits in Toronto. So this is Get a Kit data that is not just ACT, but for the city of Toronto. And if we can go to the next slide. So we, based on how people register into the study, we asked for some gender-based data of the people who responded to that. 72% of those identified as cis male, 19% as cis female, and then in these smaller numbers, so we have 1%, but that was 19 trans femme folks, 27 trans masc folks, and 125 non-binary or gender non-conforming folks. And so, yeah, that's okay. You can continue on. I think part of what struck me about that data is, as an organization, and my team works with both gay men, but also I have staff that work with women, and it is exciting to see more femme presenting and trans non-binary folks gaining access to testing, because in Toronto, there have been many experiences where that has not felt accessible and has felt hard to get to. So when we asked about ages, over 75% of the cohort of this almost 2,000 tests were in the age range of 20 to 40. And when we talk about 3% on either end of the younger folks, that was 50 tests went to people under the age of 19, and 62 tests went to the 60 and over group. But this is kind of what we had expected based on ACT's demographic of folks we serve. We were also curious about ethno-racial background and how people identify. So 38% of folks getting tests in Toronto. So this is not just ACT's demographic. This is Get a Kit is also linked to other ethno-racial ASOs like Black Cap, ASAP, and Women's Health and Women's Hands, and some other sites. So, but this is Toronto data. 38% of the tests were picked up by white individuals, so 708 tests. 409 or 22% went to South Asian, 16% or 290 tests went to African, Caribbean, and Black individuals. 8% or 143 tests went to Latinx. 7% for South Asian, 6% for Arab, 2% for Indigenous, and that was a total of 36 tests. And 18 individuals identified as prefer not to answer the question, and that ranked at 1%. Next slide, please. Something that came up for me, and this number has gone up a bit in the last 8 months. 38% of the people who picked up the tests had never tested for HIV before. And that was striking to me. About 8 months ago, we were at closer to 30%, but to almost be at 40% of the people who are getting these tests and they've never tested before is, I think, for me, really speaks volumes about access and uptake, and I'm curious about what might have prevented people from testing in brick and mortar sites in Toronto, and how folks hear about this idea of HIV self-testing. So I think this is exciting, and I think it's really telling about the importance of many access points to HIV self-testing. Not reflected here, though, is 72 to 75% of the people who received tests were from affected groups. So those groups that Heeho spoke about around GBQ MSM, people who inject drugs or use substances, people involved in sex work, and those kinds of things. So 3/4 of the tests are landing with people who from those priority populations. And my last slide, this piece is the positivity rate. So provincially in Ontario, based on what we call OHESI data, or on public health rates of positivity, we see a 0.1% positivity rate. So 0.1 of the tests, HIV tests that are completed in the province of Ontario come back as positive. In the Get a Kit data for the city of Toronto, 0.25% came back as positive, which is 5 of the 1,996 tests, but it still is, again, to me, is speaking to the tests going to individuals who need to be tested and who want to be tested and who may not have known their HIV status otherwise. And so I'm a big proponent, and I'm really excited about HIV self-testing, and also excited to kind of continue the conversation both with Heeho, but also with all of you about what that looks like, both locally for all of you, but also nationally, as I realize that the PHAC HIV self-test support is coming to an end. And federally, we will, when I spoke to PHAC a couple of weeks ago, it sounds as though the HIV self-tests in stock will probably run out by the fall of 2024. So I'm not a politician, I'm also not a doctor, but I am curious about what access and uptake will look like moving forward when I think these projects have been really successful. But I'm going to throw it back over to Heeho and happy to answer questions along the way.
Right. Thank you for that, Ryan. That was actually so insightful to see what the data is actually in the process. So we're gonna move on a little bit to our research. I'm gonna go through the method and our participants' demographics, and then go into the data where I'll present it, and then Ryan will give his insights in sort of conversation with the data. So for the methods, between June 2020 and December 2021, we conducted virtual focus groups and interviews with 18 sexual health service providers and 38 2SGBQM service users based across Ontario. The focus groups and interviews were conducted online because of the health concerns and government restrictions at the time during the COVID-19 pandemic. And we use community-based participatory research principles in our research. So 4 peer researchers like myself, include self-identifying as members of the 2SGBQM community, conducted different stages of research from recruitment, data collection, analysis, and knowledge translation like this webinar, and a community advisory board comprising of 2SGBQM with professional or personal experience with knowledge regarding experience and knowledge regarding sexual health up to SGBQM were consulted throughout our study to provide feedback on our findings or help direct our research. And finally, the transcripts were coded and analyzed using reflexive thematic analysis techniques and with the help of the NVivo 12 software. So our service user participants. In the first phase of recruitment, our data collection took place between June and September 2020, and 31 2SGBQM were recruited and participated in either focus groups or interviews. Then following consultations from our CAV, we identified an underrepresentation of Indigenous and Black 2SGBQM in our initial sample. So we conducted another phase of recruitment and data collection between September and December 2021 to highlight the experiences of Indigenous and Black 2SGBQM in our research, and we added 7 additional participants. In total, there were 10 focus groups and 7 interviews with 38 2SGBQM, and the participants were 22 to 58 years old, with 32 being the average. Around half identified as white, and the majority identified as gay, and also a majority identified as cisgender. So here we have sort of a visual breakdown of our participants' sexual orientation and gender. I'll give a couple seconds for people to take a look. And then we also have representation of their ethnicity. Again, a couple of seconds. And now we have our service provider participants. Between October 2020 and February 2021, we conducted 3 focus groups and 11 interviews with 18 sexual health service providers currently working in Ontario at the time. Most providers had over 5 years of experience, and our providers serve several populations ranging from GBM, people who inject drugs, trans and not gender non-conforming individuals, sex workers, immigrants and newcomers, and youth. And the occupation of the service provider participants varied from frontline workers at aid service organizations, sexual health nurses, physicians, public health workers, and clinic counselors. And our providers served a wide array of regions from the Greater Toronto Area, Ottawa, and our other large urban centers like Barrie, Guelph, and Kingston, as noted below, and then in rural communities like the Muskoka region. So now we'll actually dig into our data. So what did we ask our participants? We asked our participants to imagine what HIV self-testing may look like in Ontario and what supports sexual health clients may need to access and successfully self-administer these tests. And our 2SGVChem service users and providers share their thoughts and recommendations for the implementation of HIV self-testing programs and services. And one thing to note is that our research actually took place, some part of it took place before HIV self-testing got approval. And then later on, it took place around the time and after it was approved. So uh, it was before these programs were actually implemented or people had actually used HIV self-testing. So we think that it kind of provides a unique insight into what people can imagine it to be from the grassroots, like ground up. So that was really interesting. And our findings are organized into three themes. First, the need for inclusive design and receiving instructions and information, balance between pricing, HIV self-testing uptake, equity and access, and public funding. And finally, a need for varied distribution methods and settings to increase access and destigmatize HIV self-testing. So, a little water. First, we will talk about inclusive design. First and foremost, both service users and providers talked about the need for clear instructions in multiple forms and mediums to make HIV self-testing easier and more accessible, as well as easier to self-administer. So, for example, it was suggested that HIV self-testing kits should include a pamphlet or information with simple and clear written instructions, along with visual aids like pictures or illustrations. And service users in particular highlighted that written instructions should be at a lower reading level so that individuals without medical knowledge or without a high level of English or French proficiency or face other linguistic barriers could also understand these instructions clearly. Some service users also highlighted that different people have different preferences. So some prefer written communication while others may respond better to visual communication. So adding simple visual aids would also help to make sure that testing process is much less intimidating and easier to follow. And in addition to that, service users also mentioned how additional resources would be helpful and necessary. So they talked about online videos that go through step-by-step instructions with using the self-test. Also, it could be helpful since it provides visual and audio communication as tools for those who may need those additional resources. And finally, for service providers, what they emphasized was how HIV self-testing kits should have information other than just instructions. So including what to expect from the test results, who to reach out for questions and concerns in case of a positive test result, warnings for what could happen with these tests. So there could be false negatives or false positive test results, and you would need confirmatory testing in those cases. And also what to do in these situations so people have that knowledge and uh, don't necessarily panic or get really upset about those results. So now both our service users and providers highlighted that clients using HIV self-testing should have an easy and accessible way to book in-person appointments through the phone, online chats, or a web page so that individuals could easily receive confirmatory testing, testing for other STBVIs as well, or receive counseling and additional information. And so now, Ryan, I'm interested to know if there's anything from here that you resonate with or want to comment on.
Yeah, like this echoes a lot kind of with what we see in community. I think we've seen, people get the videos that come with the Insti test are great for people who have technology and web access and are able to access through the portal and watch a video about how to administer an Insti test. Visual aids like that do help with comfort in implementing a test. Um, but for some folks, computer access is not as readily available. We learned in COVID that a lot of folks may only have a single computer at home, and that might be occupied by younger people, little people, or school-age folks. And so computer literacy is sometimes a challenge with accessing those visual aids. No matter how many times I read in this manual or watch on the thing about like, don't like drag your finger across the top to drop your blood in. That's what I hear is the most consistent cause of inconclusive HIV self-tests is that, people, it looks so easy on videos, but when it comes to poking your own finger and finding blood coming out of your own body, and not contaminating that drop of blood between your finger and the test has been a significant challenge at a community level as far as inconclusive tests. And so with that, we've also seen a lot of people needing to take a second and third test. So a lot of the volume of these tests has been just kind of human discomfort or lack of familiarity with how to implement the tests. The other pieces is we're in many of these urban centers and in the places where we work, we encounter a lot of newcomers where English is not their first language, or this is their first time encountering that test. And so, how do we make these tests accessible, and do we have instructions that are written in people's language of their native tongue or their home language where they speak the language they speak at home. So wanting to make sure that we have those accessibility pieces as much as we can. So yeah.
Yeah, I think that's very true. We live in a place that's so diverse, and new people come in all the time, and they also need access to HIV testing or HIV self-testing.
Mm.
And the part about dragging your fingers also kind of rings a bell for me because I think in one of the sources I included in the background, or a source that I read during the research, they did some researchers did a lot of tests where they put people in a room and then they watch them and then let them do the test by following instructions and doing it on their own. And they also noted that consistently the one thing that people would do wrong in the test would be to drag the fingers. Because I think it's some sort of like very human thing to be like, okay, let me get the very last drop, or let me just make sure that everything is in there. So I think that's something maybe we could highlight in
Yeah,
these services and programs.
I agree. And another thing that kind of came up that we learned over the last few years with HIV self-testing is when it is upon yourself to interpret the results of a test, what is the control and what is your reactive, non-reactive dot? And so needing to really think through how do we build capacity at community around a dot as a dot. And so, like, is it faint? Is it a shadow? Like, how strong does this dot need to be in order for me to trust that this test is working? And there's a natural anxiety, right? There we're accessing information that could be life changing. And so people want to know that people want to make sure that the information that they're interpreting is accurate. And so um, part of this arc of the last couple of years has been uh, the research projects that we worked with the HIV self-testing have needed to create some additional forms that are like, these are some samples of what a test would look like. And even if it's faint, a dot is still a dot and presume that it is reactive if that is the case. But people don't know. And, we're all kind of learning as we go. And if it's their first time ever testing, that's a stressful situation.
Exactly. Just want to cover all the bases of what
Yeah.
could happen.
Mhm.
Um, so I also included some quotes just to illustrate what our data look like. So first here, we have a quote from Cliff, our service user, reiterating the need to make sure that language that's used in these HIV self-testing kits or instructions are at a reading level that is accessible to the widest audience. And we also have Calum, a public health worker, emphasizing the importance of informing and educating users about things like sexual health testing and STBBIs broadly, aside from HIV self-testing, to make sure that people are aware that HIV self-testing is a useful tool for HIV testing, but it doesn't test for other SCPBIs. And so what else would you need on top of this tool for sexual health? Um, Next, we have pricing and what people said about that. So both our service users and providers overwhelmingly agreed that HIV self-testing kits should ideally be available for free to anyone who needs them, especially within this context in Ontario, where in-person point-of-care testing is offered for free through public funding. Um, and when asked to assign a reasonable cost for HIV self-testing kits, most participants on both service user and participant side, provider side, talked about $20 or less as the most appropriate cost for purchasing HIV self-testing kits. And that HIV self-testing kits, if they cost more than $20, most would consider to be inaccessible. Within service users, there's an interplay between the cost of HIV self-testing kits, convenience, and likelihood of using them. So some share that personally, if there were any costs associated with HIV self-testing, they would not use it at all. They wouldn't even consider it. Since again, because clinic-based testing is available for free through public funding. Others still suggested that they may pay for that premium for HIV self-testing based on how urgently they need testing and what situation or context they're in at the time of making that decision, where maybe they want to get testing as soon as possible to have a peace of mind to just knowing what their status may be. So some service users also suggested that HIV self-testing should be available for free to those who may not be able to afford it through various government programs that currently exist in Ontario. So they mentioned things like Ontario Disability Support Program or Ontario Works. And for service providers, they also believe that HIV self-testing kits should be provided for free, ideally, but they had some reservations regarding the specific funding structure for implementing such services and programs. So they talked about the potential issue of having to balance existing funding amounts for programs that they already provide on top of HIV self-testing. And so they're wondering, like, would there be additional funding available to provide this program, or would the money have to come from what they already have? And also, how would that impact their resource allocation, and would that impact in-person services that are also really valuable and important as a tool in HIV, in sexual health testing and care? So I think here, Ryan, you can also shed some insight from your experience at ACT implementing these services and programs and distributing them, and you kind of alluded to it earlier.
Yeah,
Um,
I think this is, I mean, I have lots of thoughts on uptake and access, but I feel like, based on some of the data you've presented and some of the stuff we've seen at a community level is the brick and mortar like sexual health clinics in Toronto, hassle-free clinic HQ, like there are spaces where those that are available to people, yet 38% of this Toronto sample had never had an HIV test. So there is something about those physical spaces that doesn't feel accessible. And it's not a criticism, but it is a reality of many populations and many individuals that something prevents them from feeling like they can go into those spaces. And I often think about BIPOC women and trans non-binary individuals and, feeling like aid serving organizations are queer-based spaces or gay men's spaces and feeling like, oh, that's not a space for me. And so if people feel like that's not the door for them, then what can we be doing to removing doors or opening other doors and opportunities for people to access. And I know that for the folks on my team that are working with femme presenting or cis women, um, that there's been a real curiosity and an uptake in this idea of self-testing because, you know, I do think gay men over the last 4 decades, their sexual health literacy has evolved and changed in response to HIV, and many have become comfortable to a certain extent talking about their sexual health with healthcare providers, and maybe going through those doors. But for other populations or for individuals where that is a new conversation, as we all reflect individually, what is it like to broker a conversation with a new healthcare provider about maybe I should get an HIV test or maybe I should engage in STI testing? There's an inherent stigma of like, what are they thinking about my behaviors or my sexual patterns or whatever that is. So those are some real hoops that individuals need to navigate through. And I know I've been in the sector for 11 years, and I know in the early stages of discussing HIV self-testing, there was considerations around no, pre and post test counseling is really important, and we should only test in brick and mortar spaces so that the individual gets pre and post test counseling. And what I think we're also seeing is that that may not be as important to individuals as their health status or their HIV status. And so accessibility, uptake, being able to have it shipped to a home, being able to have it shipped to a friend's home to get those tests is really important. And the sustainability question is probably on all of our minds on this call, but certainly it's in the news, it's in community. People are wondering, this project's been around for a while, we've been able to get free tests, but what next? And it's hard when people at a community level or people who've come in contact with these projects develop relationship, develop trust, and then as we've seen, the economy is hard, funding dries up, and then what happens next? In COVID, as we all saw in Canada, sexual health clinics were closed because we need like redeployment of those medical workers were sent to COVID clinics and testing sites and those kinds of things. So we've already seen waves where there were barriers to sexual health testing, and this was a nice way to increase access in a time when people weren't able to find places to do this kind of testing. So I worry for an an increased number of people who don't know their HIV status, don't feel like they can access testing, but they're still living life and engaging in sex and substance use and injection drug use and life, but they may not know their HIV status, and that will continue to be a health concern in a public way.
Yeah. Yeah, I think that's really important. And like you mentioned earlier, like how that funding, that $8 million and the stockpile of HIV self-testing kits, that's slowly uh, decreasing. And there's a lot of question about like, are we going to run out and how are we going to keep providing it? And I think I think my one concern would be that, there's get a kid and I'm ready. And there's also all these people who've used it and service providers who gave it, provided it, and know that there's a lot of value in HIV self-testing and that it works. But then if funding is not there, it's like we know that it's great, but we don't have it anymore. And again, yeah, people who develop relationships with it and can't rely on it anymore. I imagine that's my concern, and I imagine it's a concern for a lot of other people as well.
Great. Yeah.
Yeah, and so sort of related to that, here I included a exchange between two service providers, and here they also share some of their reservations and considerations regarding HIV self-testing and how available funding and resources could be used between HIV self-testing and existing services. And Caleb in particular was talking about how, yes, this HIV self-testing looks like a great tool and a great program to be providing, but how is it, what's the reality of it? How is it actually going to impact our work and our resources? And so last, we have distribution. So here, our participants identified different locations and organizations as potential sites for distributing HIV self-testing kits. So they gave us a lot of places and an extensive list. So clinical settings, this includes public health units, community health centers, walk-in clinics, private labs, and family doctors' offices. They also talked about community settings, so aid service organizations, homeless shelters, women's shelters, other community-based organizations and agencies that work with the community. They also talked about public settings, so pharmacies, drugstores, so think Shoppers Drug Mart or Rexall as an example, big box stores, so like Walmart, and they also talked about dollar stores. And to that last point, what was really interesting and stood out for us throughout the interviews and focus groups was that there were a lot of our participants on both service user and provider sides that make comparisons between HIV self-testing kits and pregnancy tests as sort of in a conceptual way. And so they believe that HIV self-testing kits should also be available wherever pregnancy tests are also sold and are available. And one provider in my mind comes to mind now, talking about how, yeah, back then when pregnancy tests were becoming a thing, there were a lot of concerns, like someone's going to test and find out if they're pregnant, and there will be a lot of emotional distress and a lot of that burden on them. But now it's so normalized and people can buy it in a lot of places. And so they sort of alluded to that and talked about HIV self-testing, imagining that it would become sort of a similar thing where people can test with trust in mind that they can access their status and be able to sort of handle it and have that resiliency. And so related to that, a lot of participants share their belief that the availability of HIV self-testing in places like pharmacies, stores, and other retail settings that are more public and more everyday settings would not only make HIV self-testing more accessible, but also HIV and sexual health testing in general less stigmatizing. And so that was a really interesting point for me. And some service providers also discussed the possibility of distributing HIV self-testing kits through the mail. And as we saw earlier, HIV self-testing is now available through the mail, whether that's private sales, research studies, or community-based programs. Um, and one really important part that I want to highlight is that a lot of participants shared that existing healthcare providers and local agencies working directly with clients and community members would be the best option for distributing HIV self-testing kits. So this was because existing providers can give the important education and information that people need before distributing the HIV self-testing kits. And clients may be more comfortable accessing them through local agencies and providers where they already have that rapport and established relationships and trust with the people that are working there. And so, uh, Ryan, you can talk about what it's like to work as a community-based distributor of HIV self-testing kits and being so close with community.
Yeah, and I'll speak briefly because I'm mindful of time, but I feel like, it's about thinking about who's accessing, for us, it's about thinking about who's accessing tests through conventional, traditional ways, and then also thinking who is underserved and where are those individuals going. And so we've had some success engaging the ballroom scene, so like the Toronto Kiki Ballroom Alliance, that is a space where we see a lot of BIPOC, racialized individuals, and trans non-binary folks that are younger and may not have been accessing testing in traditional ways. So going to their ballroom practices and distributing tests at those spaces, we've had a really interesting uptake and great conversations about the importance of testing and those kinds of things, which has been great. The other piece that I will just mention is thinking beyond health-based services and big box stores is also sometimes thinking about faith-based spaces. So for some of our African, Caribbean, and Black women or BIPOC folks, it's not just addressing stigma in health centers, it's brokering those hard conversations both in shelters around HIV stigma in the shelter and can we distribute kits in those spaces, but also dealing with and working with faith leaders to say how is HIV talked about and destigmatized where someone might be seeking support from a leader in that institution? And is this something that we can do capacity building and stigma work in faith-based spaces as well, which is, yeah, trying to reach as many people as we can.
Yeah,
Yeah.
and from the literature that I've read, and also report from the World Health Organization, they talk about how there isn't research yet from distributing from faith-based organizations or workplaces, but they do explicitly say like these are potential sites where we can also distribute HIV self-testing kits to reach a wider audience and also again destigmatize HIV, sexual health testing, and HIV testing. So mindful of time. Here's a quote from George imagining how HIV self-testing being available in everyday settings would help destigmatize HIV and HIV self-testing. And another quote from Jack, a frontline worker, sharing their belief that local organizations may be the best place to distribute HIV self-testing kits because of those established trust and relationships. So here we're reaching the end of our presentation. We have a summary of the data, but we want to move on to some discussion. So we'll go into some discussion questions for people to jump off of. But if you have other questions or things you want to talk about, you're free to talk about them.